So, while we are waiting for the speakers to come on, Sidharth, Lokesh, Vishal, without wasting time, let me just give an introduction. When we are looking at technology or anything that is happening related to healthcare, I always say that there are three things that we are impacting. And these three things are, one is the access to healthcare, which has been a challenge in our country until recently, when the technology kind of took over and started bridging the gap between the need for healthcare and the provision of healthcare. And I think technology is what made the difference there. Second is, I speak about the quality of healthcare that we are able to provide and the affordability. And these go hand in hand, because it's not about, we've always heard people saying that, it's an apple to apple comparison, because you can't say that I'm going to provide healthcare, but it's not going to be as good because you're not paying as much. So I think technology is what is impacting these three pillars of healthcare. And today in front of you is a panel which is, of the three people who lead in their own respect the technology that is impacting these three things. We have Sidharth, who's the CEO of Lupin Digital, that is bringing cardiac care and actually helping the hospitals bring quality cardiac care at home and bridging the gap of ensuring that they're always connected. We have Lokesh, whose company AliveCor has got the handheld ECG machines, which is actually helping you getting access to your live ECG and it reaching the doctor where he can guide you whether you can actually you need immediate attention or not. And then I don't think I need to introduce Vishal, who's the founder of GOQii, who's brought in the what we call the Internet of Medical Things to people, because so thank you so much for making it to the conference. My first question is around, how do you think that healthcare related to the IoTs is transforming healthcare? Because the first thing that comes to our mind when we are talking of healthcare is, we have surgeries, we have teleconsultations, but suddenly the impact is moving towards remote monitoring and ensuring self-care, and that is where the IoT is playing a role. So how do you think, Sidharth, maybe let's begin with you. So how do you think it is evolving the healthcare as we see today?
So I think, thanks so much for that setup. The overall focus in healthcare, like Dr. Anurag rightly mentioned, is moving towards preventative healthcare. You really don't want the person to end up in hospital. That should be the last line of defense. And that's where I think a lot of investment is happening in remote patient monitoring, where you are able to monitor patients, even chronic patients, from their homes. Classic example is say with heart failure. Folks where the heart isn't pumping as much as it should, and there could be multiple complications, but you obviously have to go back home and live your life. So how do I make sure that I'm able to measure your heart activity? How do I measure your cardiac markers while you are going about your activity? We've recently built an application where we can just take a photo of your feet. One of the telltale signs of heart failure is pedal edema, essentially water getting logged in your feet. So your feet swell up. We can actually measure that through sort of taking a photo and AI and actually convey to the doctor whether he probably needs to increase a diuretic dose or how he needs to treat the patient while he's still at home. I think the incentives especially line up in geographies like the US, where payers, insurance companies actually have penalties for hospitals if there is repeated hospitalization of the patient. Otherwise, there's a perverse incentive where the hospital would love for the guy to keep coming back and insurance to keep paying. So insurance companies are very clear. We'll pay once, and a heart failure patient shouldn't come back in the next 3 months, right? No matter how severe. And therefore, hospitals then invest in remote patient monitoring and remote care. So I think that's the first step. I believe it's a $1.75 billion market already, expected to grow around 18-20% CAGR over the next 5 to 7 years. I think the more interesting play, and that's where GOQii and AliveCor and so many solutions are positioned, is actually making sure that you aren't necessarily monitoring patients before an event or after an event. You sort of prevent the event in the first place. And that sort of focus in wellness and ensuring that the patient doesn't come to that point will be quite crucial.
I think, that's a very beautiful point that, we are moving towards preventive, and the technology is actually enabling the hospital to do that. Lokesh, what is your view on this? How do you think the IoT is changing the way healthcare is being delivered today?
Binder, and I think, I completely agree with what Sid just said. So from our own perspective, what we are seeing is a couple of things. And Dr. Batra spoke about the 3 Ps. I'm talking about the 2 Ps, the last 2 Ps. One is the preventive bit that Sid also spoke about. We've done some, large-scale studies in India, also commercial studies in India, et cetera, et cetera. Now, data coming from these studies are telling us that almost 8 to 10% of people walking into a PHC, CHC, health and wellness center kind of a setup need a cardiologist follow-up. Can you believe how big that number is? And I'm not talking about things like high heart rate. I'm discounting all of that. I'm talking about things that could lead to major issues in the future. So when we are doing thousands and thousands of screening programs across the country, that is something that the preventive aspect is coming out very strongly. And I think the next one, which is even more important, is the predictive bit. And I think, when we look at a very specialized technology like ours, which is ECG and all the determinations you can make out of that. But when you combine it with an ecosystem play, for example, that Lupin is building or GOQii is building, that gets you potentially to a predictive play as well. And I think that if we can get there through the right partnerships, et cetera, I think that will be really, really great. For now, even if we can get to preventive, I think it's a huge win for us. And that's what we are focused in India. Just like Sid said, in the US, Europe, the markets are very individual focused. We believe in India is going to be mass focused so that we can really take care of people's health, especially where access is a problem.
So, Vishal, let me come to you, because the 2 Ps that got mentioned in the last 2 panelists talking is predictability, because it's only when you know that something might happen is when you can take a action and prevent it. So you're not waiting for the incident to happen. So, and to make sure what IoT does is the data that it collects, right? So my question to you is, how is data and the intelligence around this data, because data itself without the intelligence has no meaning, is helping individuals as well as practitioners to ensure that prevention takes place?
Thanks again. And I think I'll go back to what Dr. Anurag started this session with, that we all know 3 things: sleep, eat less, and move more. These are the fundamentals of, living healthy. The problem is that data in itself is unfortunately junk. We have too much data already. I've been tracking my life and my health from ever since the first Fitbit came out. So, and all of us in this room already know that whether you should not be eating junk food, you should not be smoking, you should not be drinking excessively, but people still do it. So is it a data problem or is it a motivation problem? So I think what I realized with our years of work around data was that data is good, but the key thing is, how do you use this data to motivate somebody to do what is right for them in any case? And that's when we came to the next aspect of incentives. Incentives drive behavior. What is currently happening is, let's look at sleep. We all want to sleep. Everybody knows that. There are billions of dollars being invested so that you don't sleep. Who's the biggest company who's culprit of this? Netflix. Netflix has openly said in their shareholders letter, and you should Google that fact, that their competition is sleep. And that is why they introduced the concept of binge watching. All episodes of serials are released at one shot because they are saying, I don't want you to sleep, versus television, which was appointment television. Second thing, we talked about eat less. I'm sorry to say, apps like Swiggy, Zomato are absolutely ruining your health. They know exactly the time you're going to crave for that samosa or that vada or that ice cream. You will get a notification. Their AI is working on it. They'll give you an offer. And even though you want to be healthy, in fact, you remember their famous ad of eating gulab jamun while watching cricket. So, unfortunately, billions are being spent on junk food delivered to your mouth literally in 10 minutes. वो जो पहले walk करते थे थोड़ा, right? You used to go out to say, at least let me buy bread and eggs and whatever, from the kirana store. Now there are companies who are saying, forget it. I will deliver to your home, and now soon somebody will say, I'll put it in your mouth also. So what is happening is billions are being invested on making you unhealthy, sick and lazy. And the challenge which all of us face is, we have the data, we can tell you कि आपको heart attack होने ही वाला है, हमको पता है, but why are you still doing that same behavior which you should not do? And I think the answer there lies in incentivization, gamification, motivation. And I mean, of course, we'll discuss this further, but all I want to tell you is, how many of you remember cashback? Paytm started there. That's what made people start using digital payments. Not because they were digital apps so hazar the, but, and that is what the incentive of saying that, अरे आप ऐसे क्यों पे कर रहे हो, उसको Paytm से पे करोगे तो आपको ₹5 वापस मिलेंगे. So suddenly the consumer started thinking that, hey, I can benefit from this behavior. And the rest is history as of today on how technology of payment has really become so interesting. So similarly, I think in health, while we are building the technology, the incentive layer, and I think we are hoping that the government with the health ID will create the right incentive layers for all of us to then use this data to make them healthy.
I completely agree with you that, just data itself is not or will not help. There has to be some kind of a motivation. Now, whether that motivation comes as a self-motivation or it is being told to you what needs to be done. And when we look at healthcare, it is the delivery institutions that actually make a difference, because it's the doctor, when he tells you that this is what you need to do, is in all probability that you will take that action. And this is usually a response to what is happening inside your body. So Sidharth and Lokesh, my question is to both of you. Whoever wants to go first. What is the acceptability of these remote monitoring devices, apps, etc., by the healthcare delivery institutions and the doctors? How do they see you as a partner which is going to help them build their practice better?
I think it's an interesting challenge because most of the providers in India are now listed companies, and therefore, while as much as they would love to focus on the long term, there is also a quarterly focus that each of them have, right? So it's not an obvious, yes, I will invest a lot of money in things that may give dividends in the future. But I think there are two interesting threads, and then I'll request Lokesh to please add. One is you see the sort of early adoption from practitioners who want to be seen as bringing the best in the world to India. So the kind of adoption that you've seen, and this is the IoT that we perhaps don't think of as much, but the IoT that's involved in pacemakers, for instance, or the IoT that's involved in insulin pumps, right? Where these are devices which are constantly tracking your markers, which are able to up-titrate in the case of a pump, or in the case of a pacemaker, are able to actually change the configuration of the pattern, is quite stunning, right? And you have a significantly higher uptake amongst Indian practitioners than perhaps even globally, right? Because there is that hunger, there is that wanting to be a global pioneer in this space. And therefore, we have seen that. And I think you will have that at one end. Obviously, the nature of technology is that typical S-curve where having been adopted, you will start seeing it getting dissipated through the society and more practitioners taking that up. So I think that's one space where we are seeing definite adoption. The second one essentially is where you are, again, like Vishal mentioned, you're able to align incentives with the hospitals. If a hospital is able to see that because of a patient engagement platform, the patient stays with them for the next 12 months. Typically, what ends up happening is there's a very common phrase in the hospital industry called loss to follow-up. More than 60% of patients are lost to follow-up within 6 months, which means after 6 months, they're no longer following up at their primary hospital. They go shopping around, they go to a GP because who'll pay 2,000 rupees for an OPD consult? I'd rather pay 500 bucks. But if there is a solution where the hospital is genuinely able to take care of the patient, handhold them, reassure them when required, do diagnostics, etc. A single point solution. The patient feels that love, the patient feels the connect with that institution and wants to go back there for checkups. He understands that the institution is not necessarily pushing me for OPDs unnecessarily, but only when required because my vitals went a certain way. In a way, that's what we are hoping to sort of provide as well. But I think independently, hospitals have reached this kind of conclusion. Insurance companies, I think, are another institution where there is interest in managed care, but hospitals are perhaps the most obvious candidates to take this up because the patient is under their care. But I'm sure Lokesh would.
Sure.
Yeah, Lokesh,
Thanks.
before you answer, I'd like to also get your perspective along with this because, we are in the business of healthcare. The whole ecosystem has to work together. And we know that when you're looking at GPs, who could be your first point of contact if you feel some pain or something not going wrong, when you go to them, despite having all these devices with them, most of the GPs or physicians are unable to read the ECG that comes out. So how do you, and I know that you work with the ICUs of large hospitals, how does this typically work where hospital also benefits from this device as much as the patient who may not be coming to the hospital in the first place?
No, absolutely, Arvind. See, these are very important points because the hospitals and the doctors they are serving a need for the people. They are not in the business of, for example, in our case, they're not in the business of selling devices. So what is the service that the doctors can provide based on a tool, which is, let's say, us, that they can give to their patients or they can use, in various kinds of settings. So the articulation of the value proposition I have learned over the last couple of years is extremely important. You can't just say that, take this device, give it to your patients, use it. But the thing is, how does it help them? You have to think through all of that and explain and have that discussion with them. I've also seen that, for example, we mostly work with cardiologists. The biggest names in cardiology are more receptive because they have probably got more exposure, having been through multiple conferences, seminars, not just in India, but in multiple countries. So they've seen how technologies like ours can support their service, right? So that's very important. What we are also seeing is, just like you said, people don't know how to read an ECG let's say for a GP who's in a small town. You can't even expect that person to be able to read something like an ECG. So I go back to my first point that more and more we are seeing small towns, cities, villages, public health programs starting to use technology in a much larger manner than being used in large cities. That's at least the case with us, and the reason is that you spoke about data and intelligence, that at least they are able to figure out if this person's rhythm is normal or not. At least the first level screening is done. Then they can say, hey, listen, now you should go and talk to a cardiologist or whoever. And multiple kinds of use cases are suddenly appearing out of nowhere, like tuberculosis. I can go into details, but we didn't have any idea that something like a tuberculosis in India, which is, quite an issue, needs ECG monitoring. And what within ECG monitoring? How can we support that? There are use cases being developed around hyperkalemia, high potassium levels, etc., which apparently can be detected using an ECG. So very interesting things. But I agree with you that we have to kind of work with hospitals and providers, tell them how it makes sense to them.
I just want to add one thing to this. It's very interesting when you actually ask hospitals and provider what is their metric of business. And the minute aapko samajh aayega, you'll understand why these things are not working. Remote care, teleconsult, technically everybody should be doing. But the reason they're not doing it in as much is because for them, the KPI is how many patients are walking into OPD. Hospital measures the entire hospital ka so many patient came and then X percentage did diagnostics, X percentage did this, they did this. So the funnel of a hospital is person walking into the clinic. And if you're running a business, all these are listed companies, they can't be cutting their funnel and saying, please don't come here. So the idea here is that I think hospitals need to go up the value chain. And if you look at models like Kaiser in the US, where the hospital's funnel is no longer about how many patients come in, but what is the outcome so that the overall cost of healthcare reduces. That is the real game which is going to incentivize the entire system to do this. And which is why, just to give you an example, we went and partnered with insurance. So one of our partners is Kotak. And we said, let's incentivize the hell out of the customer to say that if you are healthy, we will give you a benefit which you can't imagine. So what we did, and I'm just summarizing this, imagine that you are just paying a premium for 1 lakh and based on your health data, the premium jumps to 5 lakhs. And this particular customer, and we have real claims data now, the actual hospitalization is 15% compared to 85-90% of normal people who are getting hospital or claims, not hospitalized. Why? Because the person on the other end, if they are just doing basic checks, the problem in India is that nobody does a simple BP or ECG. जब तक उसको हार्ट अटैक होता है उसके बाद में ये सब करते हैं लोग और पता चलता है कि अरे यार your heart is 40-90% blocked or whatever. This should be done before, and that is the behavior we are trying to incentivize. And similarly for a hospital, the model needs to be that how do they benefit from this remote, and not for their business team, that because of this actually my overall business has gone down. That's the problem in the system.
This is a very interesting point that you have brought up, and I want to discuss this. That do you think the hospitals actually see you as partners, or do they actually see you as competition? Anybody who wants to go in for this?
I mean, not us, absolutely. We are not in the business of providing, patient care like the hospitals do. We see ourselves as a tool that helps doctors improve their productivity and improve access to care. So, not us for sure.
I think there is always a tendency to treat someone as potential competition. But we've seen in the dialysis space, right? You've seen one company sort of provide the service to several hospitals. And I think they were able to do it by showing that either they could run it profitably or the hospitals could make a loss on it, right? So if you've picked a fairly niche specialty where you know that the hospital themselves knows that they will not be able to make the kind of investment it takes, right? You are in the health tech space. We have 50 people sitting sort of 10 kilometers from here who are working on algorithms, who are working on intuitive sort of patient interfaces, which a hospital knows that they will not be able to do. So I think if you're able to demonstrate that value to them, and the fact that we promise that Lupin will not open a hospital, right? So we are not going to be in a competing space. Then it sort of makes sense to several of them. But it has to be a niche specialty. It has to be something where you can go far deeper than they would ever want to. And it shouldn't be such a large TAM or target available market that they would want to do it themselves. So I think it's a little bit of finding the right space.
Here is the conflict of interest part, right? That who's your customer? Is the hospital your customer? Is a doctor your customer? Or is the user? And I'm not calling this person patient, because 99% of my users are not patients because they are not sick. So we in fact call them players. And as you know, Khiladi Akshay Kumar is also our brand ambassador. So we are saying that you're not sick, sickness is episodic, right? You maybe get sick once, twice, thrice, 4 times a year, and usse zyada hai, then to you have a serious health problem. But out of 365 days, let's assume you are sick for 10, 20, 30 days. The rest 330 days is what we are helping the people. That's our pitch to the doctors and hospitals. And my point is that the minute the person steps out of your clinic, who's taking care of them? So we are positioning ourselves as a partner, not competing with the patient at all. In fact, we are saying that patient agar aaya to we'll bring them back to you, because we are not in the business of patient care. We are in the business of making sure wo patient na rahe, and agar jaise hi aapke hospital se bahar jaye, who's taking care of that person? So that has been our pitch, and that has really worked, because the minute, everybody is running a commercial organization, the minute they feel that you are going to have a negative impact on their business, clearly they will not be interested in promoting you. So the partnership approach really works. And, we did a similar partnership with none other than NHS in the UK. So UK has now implemented our system because their incentive was that they want patients to be remote cared, and because you just can't get appointments in the UK. So there is so much of problem of capacity. So we are actually helping them, saying that if there is a person with a non-communicable disease, we will make sure that they are outside remote cared, so that they are not becoming a burden to your system. So it's all about figuring out that what is the incentive the system is seeking, and then delivering that, but representing the interest of the player or the user in our case.
Got it. Vishal, you spoke about incentives. And prior to that, you had also given an example of how Paytm started and they were giving a cashback. You come from a background where you've dealt with users, engagement, you were into gaming space. So you have a fair knowledge about, consumer engagement, right? How are you positioning your IoT product in such a manner that it cuts across the barrier of affordability and incentivizes them and remains the user remains engaged without feeling the burden of the money that they're spending?
Well, that's exactly the point, right? We first thought that who are the people who are spending on healthcare who will be interested in this picture that we can help them reduce their spend. So it's either governments, or it is insurance companies, or employers, or people who are self-employed. Between all of us, either your company is paying for your insurance, or you are self-paying, or you are covered under some government program. These are the 3 ways, or you are not insured at all, where you are paying out of pocket completely. So our entire story is that how do we go to these 4 stakeholders and convince them that this solution is going to incentivize them, and instead of spending money on medication, they can spend that money on good food, experiences with their family, on healthy living, on going to a gym, on walking. So we are not saying that you will not spend money, but we are saying, would you rather spend that money, sitting in a hospital bed and, having all the bitter medicines, or would you want to do that living a healthy life? So that has been the pitch. And one thing which we just announced last week in Singapore, our partnership with the Force of Good Foundation and Animoca, which is in the Web3 space. So they are actually launching a healthcare token, which is going to be a fungible token. So think of it like the airline rewards equivalent for healthy living. So you could start earning these tokens, which is going to be called UHT, Universal Health Token, by your health data. And then you can use these tokens on health food, gym, insurance. So all the people who want to incentivize you to be healthy will say, I am willing to accept this. So it creates this network of people who are rewarding you for health and incentivizing you. Of course, McDonald's will not be allowed to use this, or all the Swiggy and Zomatos of the world. But yes, if there is a brand who says I am delivering healthy food, they could be part of our network accepting this token. So we are trying to create that kind of a network, and similarly that token holder could use the Lupin app or the AliveCor, because that person is earned that token by proving that they are coming from a preventative mindset. So we are working on something like this. So hopefully soon.
So, before I ask my last question to the panel, I want to open up to the audience to ask a question, because, the whole idea of putting across this conference is to benefit the people who come and attend this. So if you have any questions, I'd rather allow you to ask a question. Anybody has any questions? Yep. Please introduce yourself and, let us know who you are addressing the question to.
Yeah, my name is Arindam. We run a established startup for cardiac care, preventive health check. My question to you, as we already told, that hospitals are measured by a revenue per bed today, and also OPD to IPD conversion and number of footfall. Now, in that perspective, when you go with a preventive health, what is the motivation factors which can generate? Because in this case, your healthcare delivery partner has to be your partner at some point of time. We can't shy away from that. Insurance can be one, but if I more consider Indian current scenario, your healthcare delivery big guys who are listed and everything, they has to. So what can be their motivation to partner with preventive health?
So I think that's the problem, right? I mean, what I believe, again, I don't know your business, that if you think about your business on what is hospital or what is pharma company or what is doctor thinking, you are actually thinking it the wrong way. You should think about what the person, the patient is thinking. And the first thing, if you ask anybody, they'll say, I don't want to get sick, I don't want to go to the hospital. So the person who's on the other side, for them, hospital is not a great experience. Nobody is, waking up every day morning and saying, I'm going to go to the hospital today. The second thing is, while the cardiac and all the diabetes, all these are how doctors and hospitals look at patients, but users don't say कि मैं cardiac के लिए जा रहा हूँ या मैं इसके लिए जा रहा हूँ. As a consumer, you don't think of yourself as organs, but medical profession always has, this is kidney doctor, this is heart doctor, this is brain doctor, but you as a patient don't think about yourself. So what is the motivation of the person on the other end is most important. So for example, we took one motivation of, we will help you become younger and healthier version of yourself. So on GOQii, we don't show you your weight or anything else. Of course, you can see that. What we show you is your age, how you are becoming younger every day. So the metric for the user is not all these parameters, but it is your age and become younger. And we actually have a meter which shows pace of aging. Is your pace of aging very high, or your pace of aging is, you are kind of getting on the other side. So it is all about understanding the motivation of your customer. So if it is the doctor and hospital, then understand their motivation. If it's the customer on the other side, understand their motivation, because otherwise you'll always be stuck in this problem.
Thank you.
We can take, Dr. Bhatt.
Gentleman there, can we get a mic to him? Mr. Prasad, can you give us some numbers, data on the impact you had? For example, if 1 lakh AliveCor, I don't know, maybe 1 million, I don't know the number, what is installed, how many people used it, how much of it saved lives, so to say, it prevented where, if you can share some data.
Sure. So Dr. Batra, the numbers look like this currently. Our devices capture approximately 5 million ECGs a month. So that's the number of ECGs that are being captured every month. We have approximately 800,000 active quarterly users. We sell approximately 60 to 70,000 devices a month currently. And I'm talking global numbers, not just India. So if you look at all these numbers, so if you look at 1 month data of 4 million ECGs, approximately 5% of those show up as abnormal. So how much is that? A million, 5%, 50,000? So 50,000 ECGs show up as abnormal. So we would like to think that those 50,000 ECGs help people take better decisions about their health. So that's the kind of scale that we are talking about. So it's, and the other thing, one of the things I'll mention, so very, very short, in a short manner, is it's extremely important for us to work very closely with doctors, hospitals, not just for commercial business, but for making sure that our use cases, etc., are properly established. Clinical research is probably what is really lacking in the medical devices space. And so one of the things that we do very, 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 knowingly and is clinical research. More than 200 research papers published in peer-reviewed journals. So unless you do that, doctors, etc., don't really get the confidence in your technology. So I think that's a huge differentiator, especially for us.
We have one more question.
Yeah, I have a question. Keshmurthy from Deshpande Foundation, mentor for startups. When you talk about IoT for medical, what comes to my mind is what is the level of utilization of technology in hospitals? For that, we need to increase the number of startups. So to identify the various problems or the hiccups in utilization of technology in hospitals using startups. We have a few startups already. But I find that the apps like, for example, Cardia is there, which will tell you the BP and arrhythmia, the heart rate, etc. Now, how much of it is being used for monitoring the patients? More of it, most of the time, we see that the patients are not being looked at as assets, in the sense to generate medical health data from the patients. There is not much of a technology utilization as of today. So we need to identify a number of startups in that area and give it to some of the foundations like ours, where we can sort of increase the technology content in the hospitals, so that IoT of medical will take a front bench. Thank you.
Thank you. Any comment on that? That was a comment. Yeah. So, last question, I think, because we are running out of time. Yeah. Yes, ma'am. Ma'am, your mic is not working, so can we just sort that out?
I'm an ophthalmologist with 20 years of post-PG experience dealing with patients directly. And last 8 years, I've always also been part of some health tech companies which are developing fundus cameras for retinal screening in the preventive areas, AI-enabled cameras. So you can say that I belong to multiple worlds, but both sides. So I have like one input and maybe one question. So one input is that, like there was a question that are you giving solutions for the patient or client or end customer, or are you being a service provider for hospital? So that disparity is always going to be there unless, we try to plug and play. Mostly the doctors feel threatened that the patients are, being taken away from their control over the patients will be taken away. But at the same time, like you said, veteran doctors who understand that this is a way to triage and let them do their own specific work and improvise on their time, get more productive while the patients are being brought to them early. That's a very good way of looking at it. So such solutions probably for long-term sustainability, they have to go hand in hand, like everybody has to be in it together. So another thing is that most of these problems are now being addressed for urban population. And how are we even going to, urban and maybe semi-urban, how are we even going to get it to the rural areas? Because training in terms of use of technology, the language barrier, so all that needs to be addressed. So how are you all going to look into this issue is what I would like the esteemed panelists to answer. Anyone can take it.
I'll just give a practical example of how it worked for us. One of the critical success factors internally for us is what we call vital adherence. Essentially, people taking their BP readings and taking their weight readings in case of heart failure at the desired frequency. We want them to take it at least once a week for BP and at least once in 3 days for weight, right? And we did a beautiful trial with the Jayadeva Institute in Bangalore. We were looking at young MI patients, so folks below the age of 40 who've had heart attacks. And given the nature of Jayadeva, the patients all come from economically weak backgrounds, and they all come from outskirts of Bangalore, right? So they're not necessarily staying in Bangalore. They would have come for episodic treatment and they would have gone back. The idea was to try and do a trial with them and try and drive adherence, reduce readmission. The single biggest needle mover for us was using WhatsApp to record vitals, right? The patient may not be perfectly comfortable with the app, but if you ask them simple questions on WhatsApp, what is your BP, type 140 by 80, as an example, folks will end up punching that number. If you tell them that it is time to take your medicines and then message them half an hour later saying, have you done it? They will say yes or no, right? So I think the whole point of digital is that you should be able to extend beyond where physical reach is possible. Otherwise, hospitals serve urban areas perfectly well, right? And I think there are, this is just one example, but I'm sure there are multiple other innovations as well.
End this by saying that look at what happened in the financial space. You know, there's not even one bank whose app is there in any major percentage in UPI. We use Paytm, PhonePe, Google Pay, etc. So similarly, in the world of health, disruption will not happen by the incumbents. You know, the hospitals, while we all can expect them, wo karenge, the reality is innovation will happen at the startup level and at the consumer level. At least that's what I personally believe, which is why we spend disproportionate time with consumers and figuring out what is going to motivate them, because they will change the behavior of the entire system, which is what happened in the world of fintech.
You know, so I'd like to close this panel, but I'd like to share something that opened up for me when I was listening to all of you, and especially the questions that were being asked. And that is that, it's time. Like you said, it's not going to be coming from the incumbent. It's going to be coming from people who are thinking differently. And one of the ways to think differently, if you go back to taking off your healthcare cap and see what is it that I'm going to do to serve the need of people who need it. Think consumer. And that is a time when you will start looking at creating something which is going to disrupt the space, because the moment the word patient comes in, the perception is that somebody is unwell. So that's the first thing. And second thing is that, I've always believed that there is one part of the ecosystem that just went missing in the last 2 decades, and which is a family physician. The person that you would go to who would measure your metrics and then will guide you who to visit, who to take, which specialist to go to. And I think your family physician to your weddings and absolutely. But when I'm listening to what technology is doing, I think technology is replacing your family physician, and this technology and this family physician is either in your wrist or on your arm or wherever, but the family physician is with you 24/7, and that's the beauty of how technology is disrupting and bringing efficiency to how we are going to live healthy and may not need to go to a hospital in the first place itself. With that, I'd like to close this panel. We have a blaring red screen in front of us saying time's up. And so thank you so much for being a great audience, and thank you so much, presenters.